On December 25th, 1809, medical history was made in an unlikely place. Not in New York or Boston or some hub in Europe which housed the world's greatest surgeons, but on the Kentucky frontier by a backwoods doctor with no degree and a brave pioneer woman who took a chance on life. In 1763, Jane Todd Crawford was born in Rockbridge County, Virginia. She was one of 8 children. To her friends and family, she was known as Ginny. In 1794, she married Thomas Crawford, and together they had 5 children, though their youngest daughter died in infancy. In 1805, they sold their land in Virginia and trekked the Wilderness Trail into Kentucky and settled 9 miles south of Greensburg. They lived the classic log cabin life, typical of the pioneers. In 1809, Jane noticed her belly began to expand, so she and her husband called for the nearest physicians. After examination, they determined she was pregnant, possibly with twins, which, in their mind, explained the abnormally large belly. Jane was in her mid-40s by this time and had already given birth 5 times. She knew something was off about this pregnancy. But it was in the Lord's hands, she thought, so she followed the doctor's advice and decided to wait it out. The pregnancy never came to term. Jane's abdomen continued to grow. She was in a great deal of pain and could no longer keep up with the chores. The Crawfords had heard of a talented doctor over in Danville, so they requested his aid. The doctor was Ephraim McDowell, who also happened to be a native of Rockbridge County, Virginia. He had been a practicing doctor in the region since 1795, and though he had no formal degree, he was certainly a trained surgeon, educated in both Edinburgh, Scotland, and Staunton, Virginia. He was likely the only surgeon in the region at the time. McDowell arrived at the Crawford home in early December, and after examining Jane, he quickly determined that she was not carrying twins. Instead, she was carrying a 22.5-pound tumor on her ovary. This was a death sentence for any woman in the 19th century. McDowell informed them of the bad news and that no medicine could help it. The only option was to have the tumor surgically removed. Jane asked him if it had ever been done successfully, to which he responded, "No, it is in the nature of an experiment." Jane Crawford had 2 options: die a slow and agonizing death, or go through with the experimental surgery and likely die of an infection. A slim chance is better than no chance. For her, the decision was an easy one. Any other death was preferable to slowly succumbing to a giant tumor. McDowell promised her that he would perform the operation, but she would have to travel to his home in Danville. Though settlements in Kentucky had boomed, this was still a frontier, full of thick woods, rough trails, and a maze of forest-covered hills. Not to mention a few river forks she would have to ford on horseback. This is not an easy trip for any woman of her condition, but bold and determined, Jane set out on horseback on a 60-mile trek for Danville, with the tumor resting on the horn of the saddle as she trotted along. It's not clear whether or not she traveled alone or how many stops she made, but she undoubtedly had her family on her mind. Would she ever spend another Christmas with her children, or was she riding to an early death? Jane arrived in Danville safely, a few days before Christmas, and took some much-needed rest. Dr. McDowell, a religious man, preferred to have his surgeries on Sundays, so that the Lord may guide his hand. That coming Sunday happened to be Christmas Day. He also did them in the morning to avoid the churchgoers who would likely protest the operation from outside his window. Surgeons were often seen as butchers, but to be fair, doctors did unintentionally kill a lot of people back then. Jane showed up at the McDowell home on Christmas morning and was prepped for surgery. Before starting, Dr. McDowell wrote down a prayer and put it in his pocket. Assisting McDowell was his nephew James, along with a few slaves. They strapped Jane to the operating table and held her down. Anesthesia was not a thing in 1809, and though morphine was isolated from opium about 5 years prior, there wasn't much of it sitting around in this neck of the woods. A bottle of whiskey would have to do. The following is a description of the procedure written by McDowell 7 years later. I made an incision about 3 inches from the musculus rectus abdominis, on the left side, continuing the same 9 inches in length, parallel with the fibers of the above-named muscle, extending into the cavity of the abdomen, and the parietes of which were a good deal contused, which we ascribed to the resting of the tumor on the horn of the saddle during her journey. The tumor then appeared full in view, but was so large that we could not take it away entire. We put a strong ligature around the fallopian tube near to the uterus. We then cut open the tumor, which was the ovarium and fibrinous part of the fallopian tube, very much enlarged. We took out 15 pounds of a dirty, gelatinous-looking substance, after which we cut through the fallopian tube and extracted the sac, which weighed 7.5 pounds. As soon as the external opening was made, the intestines rushed out upon the table. So completely was the abdomen filled by the tumor that they could not be replaced during the operation, which was terminated in about 25 minutes. We then turned her upon her left side so as to permit the blood to escape, after which we closed the external opening with the interrupted suture, leaving out, at the lower end of the incision, the ligature which surrounded the fallopian tube. Between every 2 stitches, we put a strip of adhesive plaster, which, by keeping the parts in contact, hastened the healing of the incision. We then applied the usual dressings, put her to bed, and prescribed a strict observance of anti-inflammation regime. In 5 days, I visited her, and much to my astonishment, found her engaged in making up her bed. I gave her particular caution for the future, and in 25 days, she returned home as she came, in good health. That was the first time McDowell wrote about the operation. When news of the surgery traveled, it was received with harsh criticism. Many denied that it even happened. But after McDowell performed more successful abdominal surgeries, many conceded. One reporter out of London wrote, "A back settlement of America, Kentucky, has beaten the mother country, nay, Europe itself, with all the boasted surgeons thereof, in the fearful and formidable operation of extraction of diseased ovaria. For the misgivings in our minds, for our uncharitableness, we ask pardon of God and of Dr. McDowell of Danville." McDowell was unsure as to why he had such a good success rate when it came to these dangerous surgeries. He wondered if he was truly blessed by God. Today, we believe it was likely his aptitude for cleanliness that spared the lives of his patients. In a bit of irony, Ephraim McDowell began to experience abdominal pains in 1830, and later died of appendicitis. He was buried in Danville, Kentucky, and his home is now a museum. After her uncomplicated recovery, Jane Todd Crawford returned to Greensburg. She and her family moved to northern Kentucky and eventually into Indiana around 1817. She lived for 32 more years and moved in with her eldest son James, who was a Presbyterian minister in the small Indiana town of Graysville. James would later do missionary work among the Plains Indians. Jane Todd Crawford died at her son's home in 1841 and was buried in a cemetery north of town. We often remember the miracle workers and doctors like Dr. Ephraim McDowell, and it's easy to forget about the patients like Jane Todd Crawford. Her bravery and determination brought on a medical breakthrough, which would save the lives of many women for years to come. That's all for this video. Have a Merry Christmas and take care.